Hello and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail. Our today's topic is female sexual health, a topic that is very important, however, not very well addressed. And the reason, we do not know. Could it be cultural? Could it be natural shyness? Females have to talk about their sexual well-being. To discuss that, we have invited in our studios today Dr. Henna Jaleel, who is a specialist in obstetrics and gynecology, but has been a consultant in sexual health and genitourinary medicine for 15 years. After leading the service for 15 years, she changed her path and became a GP, but again with special interest in sexual health. Let's welcome Dr. Henna Jaleel. Hello, Dr. Henna Jaleel. Thank you very much for coming today to discuss a very important topic.
It's a pleasure, Amara. Thank you for inviting.
So tell us about how do you define female sexual health?
Defining may be a bit difficult, but how I see female sexual health is that it is part of a female well-being. So you cannot differentiate a sexual health from a general health of a female. And that is how I would look at female sexual health. So it will deal with her physical health, with her psychological health, and of course with sexual health as well.
And so in the sexual health, what are the common problems? What can go wrong? And I'm sure you are dealing with a lot of women with female sexual dysfunction. What are the common problems that you come across?
Right. So before I answer that question, may I just elaborate on what female sexual ability or performance is involved in with. So if we look at the female sexual cycle, it starts with an interest in sex, and then it leads to arousal, which is actually followed by orgasm, penetration, and after that there's a period of relaxation. So do you want me to elaborate?
Yeah, tell us about when things are not working very well. What are the causes of why women have problems?
Okay, so first of all, let's talk about when it's working well. Okay, so when a woman is interested in sex, she will actually have a desire to have sex. This will be followed by an arousal. In the process of arousal, what we are having is increased vascularity, the blood supply is increased and the nerves becomes more sensitive. So when we talk about the blood supply and the nerves becoming more sensitive, they are of genital areas and also with the genital associated areas, for example, breasts as well. So when there is more circulation and hypersensitivity, there is more blood flow in the vaginal regions, in the pelvic floor regions, and she becomes very sensitive to touch. This is actually followed by orgasm. And in orgasm, there is rhythmic movements of pelvic floor and the vaginal muscles, basically. And after that, penetration happens, or before that penetration happens, depends on the other partner as well. After the orgasm, there will be a period of relaxation when there is bonding which is happening. Now, all these processes are, of course, influenced by anatomy, they are influenced by physiology, they are influenced by neurotransmitter, social problems which a woman has, and also about her past medical history or her what medication she's on. So when you talk about what can go wrong, actually anything can go wrong with this. So the problem could be of general well-being, the problem could be of psychological well-being, problem could be with genital anatomy, problem could be with neurotransmitters, not having the right balance. So we need to explore that further to identify the causes of it. For example, If you talk about organic causes, which are easier to identify, it can be as simple as she's anemic. If she's anemic, she doesn't have a desire.
Okay.
You know, because she's tired all the time. Lots of women come to me saying that tired all the time. It's a very common presenting problem with a woman, basically. Men as well, but more with women. Tiredness all the time. It can be as simple as she hasn't got enough hemoglobin, or she's anemic, or there's a thyroid problem, or lack of B12, vitamin D, diabetes, kidney problems.
Okay. And how common is the female sexual dysfunction? Do you see a lot of women with these issues?
No. No one actually comes up as a presenting problem of female sexual dysfunction, but it does come as when they're talking about something else. It does come from time to time. There is not, when you talk about the prevalence as such, there is not much data, especially in UK, but US, they have quoted the prevalence. The prevalence mostly is, which they have found, is in age range between 50s and 60s, that is around the time of menopause. And as many as 75% of the women in one of the studies have actually said they have got a problem, saying that it affects all age of women. Because it affects desire, it affects arousal, orgasm, and penetration. Unfortunately, most of the women who present to us, they present with dyspareunia, which is a recognized symptom. But there are very few women who talk about arousal problems.
So dyspareunia meaning painful sex?
Painful sex, yes. So that is the main problem which people do open up with. But very small amount of women, I would say, would actually talk about problems with arousal or orgasm as such.
And what do you think is the reason for these barriers why women don't want to talk about this problem, which is so important for their married life and for their, again, like mental well-being as well, because if they are unable to satisfy their partners, it becomes, it just brings these differences between the partners, and that can affect their relationship and all that. So why do you think that they don't want to come forward and discuss that?
Yeah. So first of all, the main problem is actually understanding your own self. There is a problem with education, because when I see women, even if they're talking about their genital problems, they will say, "Doctor, I have got a problem down below." So using the simple terminology, vulva, vagina, clitoris, what is it?
Because it's considered a shameful thing to take the name of...
Exactly. So talking about sex, they will say, "Oh, I'm sleeping with my husband," or "I'm sleeping with a partner," or, you know, "It hurts when I do the deed." So it is like, you know, we can talk about nose, we can talk about eyes, but why can't we talk about vulva, vagina, perineum? It's their body. Most of the women, they don't even know what genitalia are like. What does it involve?
Because it's a forbidden territory. It's not supposed to be discussed. That's what I see, that most women think that it's shameful to talk about their personal bits.
Yeah, let's leave the word discussion and let's leave the word talking about. I'm talking about awareness, knowing your body yourself. People don't even know their body themselves. And what I tell my patients is that have a mirror, sit down on it, and actually look. Where is the pain? What is causing pain? Or where do you think is there a lump? Or whatever symptom they are saying, they need to tell me, but they are so, you know, scared or disinformed or uninformed. So that is one of the reasons, is education. The second problem is that our society, as I say, is not able to give or to accept the words which are for the genitalia. The third thing is that the trust. Do they have that trust that what they are saying is actually be listened sympathetically? And as you actually mentioned in your question earlier, satisfying the men, we always talk about satisfying the men. What about satisfying a woman herself?
Absolutely.
So that sort of a thing, like, is it my fault? Is there a issue of guilt? Is talking about not having enough drive or orgasm, is it the fault of women? So what we talk about relatively comfortably, I would say, is penetration. So we talk about erectile dysfunction, we talk about dyspareunia or painful sex, as you clarify it. But when we talk about arousal or when we talk about orgasm, especially in a woman, I don't think so. A woman has got that comfort. And saying that, the professional, the medical professional who is actually listening to that problem should also be open for that discussion. And they should,
you mean the medical professionals should encourage women to actually talk about it?
That's true. That's true.
Because then only they will have this confidence that women will open up, because a lot of times it's just a little encouragement you have to give them before they start talking about it very openly and without any hesitation.
And after that, so once they have started talking about it, then you have to find the time in the consultation to actually go into the detail of that. Because even if you have initiated a consultation, as I say, you need to have a very detailed history of that woman. And that starts from childhood. Has there been any abuses in the childhood, physical or sexual? Because that could contribute. Social circumstances. How was she brought up with? Because sometimes, people who have got very restricted upbringing, sex might be a taboo. It might be seen unclean. It might be seen just for procreation, just to satisfy men. So we need to look at not just the problems or just the complaint or just, what she wants, but a background. So upbringing, as I say, social circumstances, her health, what pressure is she on? Is she on any medications? Is she overworked?
And do you see any racial differences? For example, you would agree that Asian women, to them, it's more of a forbidden area to talk about sex compared to other cultures. Do you see the difference, or it's just a myth?
No, there is. So first of all, there is a difference between men and women. Men still talk about it because of ED, they can have Viagra over the counter. Women, they don't. Then there is a difference between the age group as well. So a younger age group, like 30s, 20s, they're still more open relatively as compared to women who are approaching menopause because of course the education, and of course after that is the difference between what ethnic group they belong to, because relatively in that age group, women who have been born and brought up here are more open for this discussion as compared to women who have been from Asian origins, and also like what they think sex is. Basically, is sex only penetration or is sex more than that? That
okay.
is
Yeah, and so this counts as emotional or psychological part with exploring the background and taking the history. What about the physical problems that can lead to women achieving sexual pleasure or satisfaction?
The physical problems, again, the physical problems can be related to anatomy. For example, there can be genital dermatosis. When I say genital dermatosis, it means skin conditions which is affecting genitalia, as simple as eczema, psoriasis, lichen sclerosis. So that can cause painful sex on entry. So when the patient talks about pain, you say, well, where is the pain? Is it on the entry or is it deep inside once the penis has entered? So this is how to differentiate that what we are talking about is it superficial or is it deep intraperitoneal? So starting from the skin, as I say, there could be skin conditions. Then we actually move forward. There could be nerve problems, for example, vestibulitis, or there could be vulvodynia, which is causing pain having sex. Because if someone has pain having sex, then of course they will have reduced arousal, just because that memory of pain is coming back.
So it becomes a psychological factor in addition to a physical element. It becomes double the problem.
Double the problem. There can be endometriosis which is causing it. There can be sexually transmitted infections. There can be recurrent thrush, because thrush actually does cause, problems with.
That must be a very common problem in the patients that you see.
That is a common problem. Recurrent thrush is a common problem.
And that is something which can be easily treated
which
as well.
Which can be treated as well. They could have a sexually transmitted infection as well. For example, Trichomonas vaginalis. It causes pain down below. It could be herpes. Genital herpes can cause pain down below, basically.
So what do you counsel women if they've got a problem, or counsel and also the management? What do you suggest that if the women, they've got a problem, they should come and see a medical professional, and the things that will be done apart from what you've said is the exploring their background, make sure they're not anemic and they don't have any underlying problems. What is the next step then?
So, as I say, first of all is the women appreciation of what, if there is a problem, and then of course if there is a problem, they also need to understand that what is their expectations. Is their expectation realistic? For example, a perimenopausal woman saying, oh, I'm not having as many orgasms as I used to have when I was in 30s. Well, she cannot walk as much as she used to when she was in 30s. So it comes with the physical. So people need to understand that aging does have an impact. Yeah. You're not able to perform as much as you were when you were in prime years of youth. So there is an expectations as well, and understanding. And again, as I say, it's very important to have the right education, because if you're not given the right education, you are actually looking into misinformation. And misinformation, it doesn't mean anything to anyone, because again, as eating is different to everyone, some people want to eat more, some less, some like chicken, some like, beef, some are vegetarian. Similar is sex. So one style doesn't fit everyone, basically. So what is satisfaction for one may not be satisfaction for others. So that's why when we define, as you said initially, female sexual dysfunction, then that dysfunction should cause distress. If there is no distress, then it's okay. She's happy with whatever she is. And it should be present for at least 6 months. And in 6 months, you should be experiencing at least 75% of the time. So if that is an issue, then it does become dysfunction, because it's giving her distress, and it is consistent. So when she comes to us, what we say is that, okay, first of all, is it primary or secondary? Means that, has she always had it? Or is it something new which is developed? And if it's something new that is developed, then is it there all the time? Or is it just in special circumstances when it's happening? Because again, that is important, because sometimes there could be things like, childbirth. There could be things like, menstrual cycle. At certain points of menstrual cycle, you're more into having an increased libido as compared to others. Breastfeeding, childbirth, any trauma, loss of jaw, drug use, alcohol. They all contribute. Too much alcohol. They all contribute towards it. People can take cannabis, cocaine. They all have an impact. Medications, they do have an impact. Someone who is on antidepressants, it reduces libido. Okay. Someone who is hypertensive and is on beta blocker, it reduces libido. There are studies which actually says even contraceptive pills, estrogen, can have an effect on libido as well.
Okay.
So a very detailed history is taken to understand the cause. If someone is menopausal, it could be just thinning of the vulva or vaginal epithelium which is causing them a problem. So that is again to be taken into consideration. Has she had breast cancer? Well, she was in anti-estrogen, which is causing, all these symptoms. So once we identify the cause and we know the cause, then dealing with the cause is easy.
Yeah. And with regards to the infection, sexually transmitted infections, you take swabs?
Yes. Yeah.
Okay, what are the common swabs that you take and what infections it rules out?
Okay, so again, depends on the symptoms. So we can take swabs even if they don't have symptoms, as you probably know, that sexually transmitted infections can be asymptomatic as well. So, but say going back, if they have got symptoms, then we take like a pivaginal swab to test for bacterial vaginosis, to test for candida, trichomonas vaginalis as well, and endocervical for chlamydia and gonorrhea. We used to do culture at some point for gonorrhea, but now there is a test called NAT testing, nucleic acid amplification test, which actually covers both chlamydia and gonorrhea. I mean, the good thing is that now you don't even actually have to see a doctor because for all these tests, because there are online tests available. Okay. So if people think that they are at a risk of sexually transmitted infections, saying that they've got a new partner or they're suspicious of the partners, having extramarital affairs, they can actually request online testing, which will be delivered to them.
And do they have to pay for it?
No, it's free. I mean, if people are in UK, it's under NHS, and the results are actually texted to them on phone.
Because a lot of people would be avoiding going to a sexual health clinic to be tested because it is seen as a taboo if somebody goes there.
Yeah.
So this is very helpful to know that these tests are available online.
The only test which is not available online, as I understand, is for herpes. So if someone has got genital sores, then it's best that they see someone, because again, genital sores can be just genital herpes, it could be cancer as well. So it's best that they see someone.
And most of these STIs or sexually transmitted infections, they can be treated with antibiotics or for thrush. Thrush treatment is available over the counter, and some people, they suffer from recurrent episodes of thrush. What do you advise to them then?
Well, someone if is having recurrent episodes of thrush, so we want to rule out why it is, because sometimes it could be as common as diabetes, which is undiagnosed. That is giving them thrush. Okay. So it's important to actually test them that they are not diabetic. Also important to say what medications they are on, because one of the medications which is used for diabetes actually reduces the blood sugar by producing sugar in the urine. And that actually predisposes people to recurrent thrush as well.
Okay.
Yeah.
And so with regards to this psychosexual element of female dysfunction, how do you then manage these women? Because of course that results in poor relationships and all that. And so is there therapy that you offer them, or how do you manage?
So again, with these psychosexual problems, if we identify, we've ruled out all the organic causes, and we find, okay, couple therapy is quite, because sometimes it is, there should be an element of trust. So they should be actually telling the professional or the therapist or the doctor, whoever they are seeing for that, the problem. Is it with that particular partner, or is it with someone else, basically? And then we advise couple therapy, that they both see the doctor or the consultant together, so that you are able to hear from the other side as well. And then they can try different methods or measures. I mean, sometimes it could be as simple as getting into the mood, people usually come and say, okay, I used to have sex before and it was so enjoyable, and now I'm losing interest. So it's just basically sometimes training your mind to actually be there where you were when you first met that person. So I'll just give you an example of an interesting case which we had. There was a problem in the relationship, and they were saying, oh, I'm not getting it, what I used to have before, the orgasm and the excitement. And we thought there was a communication issue between them. And we suggested, oh, why don't you spend some time together, and have a feel, talk. I think the thing is that having an intimate relationship, which includes spending time together, be able to discuss what you want and how you want, is important. Anyway, long story short, so we advised, why don't you go on a shopping spree together? And she told us this was like their own original idea. She actually went for a shopping spree to buy a lingerie, and she was actually trying different bras and sending photos to her husband, saying like which one is better, which one is not, and that actually was a trigger to put them to get them
Back on the track.
On the track. And she says, oh, they really enjoyed having time together. So I think once you help motivate that conversation, they will find their own intimate moments and how to go back. But again, they can have regular counseling sessions with a trained couple therapist to sort out if there are any relationship issues.
And emotional binding is also very important, because in some cultures where usually men and women, they have sex for the first time. Maybe for men it is easy, but women, they develop some emotional bonding before they reach to the point. Do you think that is a problem, or it's not?
Well, it is, because you need to know the person. It's a very intimate relationship, and as we say that all these neurotransmitters like dopamine, serotonin, oxytocin, adrenaline, noradrenaline, they play an important part in satisfaction, and all these comes when there is a stable relationship together. And I just wanted to talk about another case at this point. So one of our patients, she was saying that she is not having satisfaction of the sex, basically arousal or orgasm, because there is the problem with her partner of premature ejaculation. So they came as a couple for counseling purposes, and it was only later, after talking to them, we found out that they haven't got a house of their own, so they're living with the parents, and the mother of the boy checks up, is he okay, after every half an hour. So of course he will have this premature ejaculation out of anxiety, and that could be the root cause problem.
Absolutely. So what do you suggest to people, how to overcome these barriers, how to encourage women to come forward and discuss these problems without hesitation with their GPs or with a health professional they trust?
So first of all, it's basically know yourself, know your own anatomy. When people say, okay, I have got a problem with arousal or a problem with desire, like, what about, are they able to have the desire themselves, even if the partner is not there? How do they feel about it? Clitoris, do they understand it exists? Can they actually, massage it? There are lots of things available for stimulation. They need to understand themselves first, and then if they know their own anatomy, if they are confident about themselves, they can actually advise their partners what gives them pleasure. So it is a two-way process, and even if by having a conversation with the partner, having a conversation and jointly working together, they still think the problem cannot be solved, then of course by all means they need to contact the doctor or the GP and or the sexual health consultant or sexual health provider or anyone, and then they have to go through a series of questions, of course, of their general well-being, of any psychological problems, of any problems they have, it could be social problems, and deal with that.
Yeah. And so you mentioned that women, they have problems when they go through menopause, or if they are perimenopausal, which is the period before they actually reach the menopause. What do you offer them in terms of treatment to improve their sexual activity or sexual health?
HRT is, once if there is no contraindication, I think HRT is the way forward. You can, but again, before that, we need to. What I do is that, because normally they present with tiredness all the time, this is what their presenting problem is. So I do the blood test basically to rule out at that age there are no diabetes, there's no hypertension, thyroid functions are fine, B12, vitamins A, all those things. That's in order. And after that, once it's all in order, we say it is, menopause. Then we can offer them HRT if there is no contraindication, and they can use vaginal estrogens, lubricants.
And these things are easily available. They don't have to.
They are available under NHS as well. So
And they need a prescription for
they
that.
do need a prescription for
Okay.
that.
Yeah, that's very helpful. So it's very clear that there could be physical as well as emotional or psychological factors that actually come in the way, and there is always treatments available, be it physical or mental or psychological. So what would be your take-home message? What would you tell our public how to raise awareness and tell our women not to be too shy about discussing this, because they will not be judged if they want to talk about it? So would you kindly give our viewers a message to encourage them to come forward and how to reach out to have some help?
The take-home message which I would like to give to our viewers is know yourself, feel yourself, understand your emotions, talk to your partners, and talk to your GP if you have got any concerns regarding to any issues, be it general health, be it sexual health, be it psychological health. Remember, it's okay to say you are not okay. Thank you.
So thank you very much, Henna, for a very insightful session today. I'm sure viewers would appreciate your knowledge you have given to them and your encouragement for them to understand about their problems, and also you're educating them to come forward and not to feel shy about it. So thank you once again.
Thank you, Amara.
So viewers, I hope you enjoyed the session and you won't feel shy about talking about your sexual health whenever and if there is a problem. So goodbye for now. I'll see you again next week with another topic.